Next at 10, back in February, a massive lawsuit was settled with multiple drug manufacturers and distributors in relation to the ongoing opioid crisis. The $26 billion settlement will be dispersed to states over the next several years. The settlements require 85% of those funds be allocated to programs that will help address the ongoing crisis. And this past week, Wisconsin received its first $6 million from that settlement.
Armand Rahman has a breakdown of how Wisconsin health officials plan to use that money. Armand?
Eric and Charlotte, this $6 million is part of $31 million Wisconsin is set to receive this year. A lot of money, but state and health officials say it's hard to put a price tag on the damage done by opioid addiction. Attorney General Josh Kaul is calling it a win in the battle against the opioid epidemic.
Those efforts to hold pharmaceutical companies accountable, as well as our continuing efforts to investigate opioid manufacturers, are beginning to lead to real results and real dollars coming to the state of Wisconsin.
Real dollars going toward a real problem. According to the Department of Health, there have been 1,400 opioid deaths in the state so far this year.
These investments are critical to help Wisconsinites now.
Most of the $400 million Wisconsin is expected to be paid in total will go toward 3 phases. The first focuses on harm reduction, expanding Narcan direct programs and access to fentanyl test strips.
We know that over 3,200 Wisconsin lives have been saved by the Narcan Direct program from 2019 to 2021.
Officials say those test strips will save lives, too. In a recent overdose spike in Dane County, more than half were people who thought they were using oxycodone, which points to possible counterfeit pills in the area.
Often people believe that they're taking a particular illegal substance, but fentanyl is mixed in with that substance.
Phase 2 zeroes in on the need for new and updated facilities across Wisconsin, including $6 million for centers in tribal nations.
They have seen a dramatic increase in opioid deaths that has caused at least 3 tribes to declare states of emergency in response to the rise in substance use and the opioid epidemic.
Finally, Phase 3 focuses on long-term project investments like treatment and family support centers.
So our medication-assisted treatment program, the room and board costs for residential substance use disorder treatment, those are things similarly that can really help a person who's ready to make a change.
And the state says rather than making a unilateral decision, they will work with individual counties and municipalities to make sure the money goes where it's needed.